All right, it is right up time to start. So let me welcome you to day 3 of the 2024 Public Health Learning Forum. Our first session of the day is Maximizing Workforce Excellence, Leveraging the Core Competencies for Public Health Professionals and Train Learning Network. But before we jump in, just a few housekeeping items to go over. Audio is available on your computer or your phone, but we kindly ask that you mute yourself so that we don't hear the background noise. We do encourage you to keep your cameras on so we can see your faces throughout the session if you choose. Feel free to drop your questions in the chat box and we'll do our best to respond to them, even though we were not responding to every candy corn chat that just went on. There will be time for question and answer with the presenters following this presentation as well. If you have any technical questions, please send a message in the chat to Nolan Gill or Brittany Rector. They will be monitoring our technical support for this session. Thank you, Nolan and Brittany, for doing that. All sessions are being recorded and will be available on the Train Learning Network in the coming weeks. Once the recordings are live, all registered participants will receive an email with the details of how to access those. In the next 90 minutes, you will hear from Jennifer Harmon and Mayela Arana. Jennifer Harmon is the Engagement Manager for the Train Learning Network at the Public Health Foundation, where she supports affiliates and learners in workforce development. Before joining Public Health Foundation, she served as the Director of the Learning Management Center at the New Mexico Department of Health. Mayela is the Senior Program Manager for the Workforce Development at Public Health Foundation. She leads the development of workforce resources and supports the Council on Linkage between academia and public health practice. The full version of their bios are available in the resource section of the reference page on Train. By the end of this session, you should be able to, 1, describe how the core competencies connect to other areas of public health practice, including the foundational public health services. You'll be able to identify 2 core competencies, tools, that can be utilized for workforce development planning. And you'll be able to describe how to utilize Train to identify courses that meet trainings and workforce development needs aligned with the core competencies. As you listen to this presentation, we encourage you to consider how you can use the results from the 2021 Public Health Wins survey or your own internal workforce capacity assessments to identify 3 competency areas where your department could benefit from professional development. Then, after you've identified these, search Train for courses that may align with these identified competency needs. With this, I will now turn it over to Jennifer and Mayela to get us started. Thank you.
Wonderful. Thank you so much, Carol. And thank you so much, everyone, for joining us for this session. We're excited to be talking to you about how you can apply the core competencies to your workforce development planning. So we're so grateful that you have chosen to join us. Before we get started, we'd love to learn a little bit about you. Please share your name, your title, and your position, and a little bit about what you'd like to learn about the core competencies in this chat. So maybe, Ron, I might ask you to help kind of parse out any of those comments coming in.
Sounds reasonable.
Thanks. Just wait a minute or so for folks to participate in the chat box.
I only see candy corn in the chat box. Got some practice colleagues.
Great.
So what do people hope to learn? That's part of what you asked for?
Mm-hmm. Linking competencies to training. Great.
Training to address gaps in competencies.
Great.
Mm-hmm.
Job descriptions, we'll be talking about that.
Trainings to meet the
Now this
different
works.
levels. Yeah.
How to identify training needs. Great. So we will be touching on a handful of these topics in the next 90 minutes. So thank you all so much for sharing. Before we dive in, we just wanted to give a quick overview of what you can expect during today's session. We're going to start by sharing some information about the core competencies for public health professionals. Then we're going to share some examples of core competencies, tools, and resources that are available for your workforce development planning efforts. Then we're going to talk about the Training Learning Network and how that can be a great resource for your workforce development. And that will also include an activity that Jennifer will walk us all through. And then hopefully we will close with some time for Q&A. So thank you again for being here. I won't spend too much time or go into too much detail about kind of a background of workforce development because Ron, Grace, and Sonia did a great job of laying the groundwork for us on Tuesday. If you were unable to attend that session, don't worry. Their slides are up in the supporting resources section of the conference page, and you'll be able to watch the full recording of that session. Hopefully sometime next week, we'll get that up for you all. But I did want to reiterate just a couple of things. There are many different activities that fall under the umbrella of workforce development. We've tried to include some examples here, but I'm sure you can think of many others. So workforce development activities are often grouped into these three buckets or something similar that represent the spectrum of recruitment to development to retention. What tends to come to mind first for many people when they think about workforce development is training. So thinking about workforce development as the spectrum of activities that you see here is a good reminder that workforce development is so much more than training. So while training is important, it is not the only way to strengthen your workforce. So workforce development includes activities that contribute to retention or help to mitigate employee turnover, such as having career pathways and opportunities for advancement, focusing on employee well-being and creating a supportive work environment, succession planning to prepare for changes in the workforce, and advocating for the workforce and its needs. Development activities can also get at determining the skills and needs of your workforce, setting goals, and then building the needed knowledge and skills through training, coaching, mentoring, and other efforts. And then, of course, recruitment efforts that help to ensure a sufficient number of workers. So things like developing job description, advertising open positions, and the hiring process and onboarding of new workers all fall into this umbrella of workforce development. All of these efforts can help to contribute to ensuring sufficient capacity, both in numbers and in the range of skills within the workforce to meet the needs. Building knowledge, skills, competence, and confidence within the workforce, ensuring a positive, supportive, and inclusive work environment, and hopefully helping to retain employees within your organization, or ensuring that as employees change, your organization isn't left with big gaps in skills. Now I'm going to spend some time talking about how the core competencies for public health professionals could fit into your organization's workforce development efforts. We wanted to highlight in particular some of the work that has been done by the Council on Linkages between academia and public health practice. The Council on Linkages is a consensus-driven collaborative of national organizations engaged in public health that work on initiatives designed to benefit the workforce broadly. The Council on Linkages has been around for about 30 years and has 24 member organizations and aims to improve the performance of individuals and organizations within public health by fostering collaboration between academia and public health practice, promoting ongoing education and training, and strengthening public health infrastructure. Members of the Council on Linkages span a variety of professional groups in public health, as you can see on the screen, as well as federal agencies, the accrediting bodies for both health departments and academic public health, and the certifying body for public health professionals. And the Public Health Foundation serves as a convener and provides staff support for the Council on Linkages. One long-standing initiative of the Council on Linkages is the Core Competencies for Public Health Professionals. The core competencies are a set of competencies designed to reflect foundational or cross-cutting knowledge and skills for all public health professionals, whether you're engaged in practice, education, or research. The core competencies have been around for 20 years and are widely used by health departments and other organizations in workforce development activities across the country. You see the core competencies a lot in assessments and guiding development and selection of training. The core competencies are revised to ensure that they reflect the current reality of working in public health, with the newest revision released in October of 2021. The 2021 version of the core competencies contains 56 competency statements and numerous sub-competency statements that describe knowledge and skills for working in public health. If you're looking at the core competencies, you will notice that they are organized in two ways. First, they are organized into 8 domains, which reflect skill areas within public health. You can see those listed on the left-hand side column on the slide. And they are also organized into 3 tiers, which describe different types of responsibilities within public health organizations, and those are on the right-hand side column. So on this next slide, we just wanted to show you an example of what you will see when you go into the big PDF of the core competencies. So this is an example from the health equity domain. And so you will see the competency statements in bold. So for example, 4.2 engages in continuous self-reflection about one's biases. And you will also see 4.3 recognizes the diversity of individuals and populations. Then you will see the various sub-competencies across the 3 tiers. And so within those boxes of sub-competencies, you will also see examples that are meant to provide just an idea, but are not meant to be an exhaustive list of what may be included within each competency statement or each sub-competency. Here is just another example from the policy development and program planning skill domain. In this one, you'll notice that for the sub-competencies, as you move from tier 1 to tier 3, the verbs just become a little bit more complex. So for example, in tier 1, you have contributes, in tier 2, you have develops, in tier 3, you have justifies. And so a lot of the sub-competencies kind of elevate in that way from tier 1 to tier 3. So the core competencies are probably the most widely used competency set within public health. The most recent data show that around 80% of state health departments are using the core competencies, 60% of tribal health organizations, 45% of local health departments, 25% of territorial health departments, and about 90% of academic programs with a public health focus use the core competencies in some way. So we also know that the core competencies are used in a variety of ways, including to guide the development of job descriptions and performance objectives, competency assessments and training needs assessments, education and training to build skills and competencies. They're also used in workforce development plans to ensure a skilled workforce. They're also used in the development of other competency sets, as well as tools and other resources to support the activities and growth of public health professionals. The core competencies also appear in major national initiatives, such as Healthy People and accreditation. Healthy People 2030 includes objectives within the public health infrastructure topic area related to increasing the proportion of state, local, tribal, territorial health agencies that use core competencies in continuing education for personnel. For those of you who work in health departments that are seeking accreditation, FAB Standard 8.2 focuses on building a competent public health workforce and leadership that practices cultural humility. And the health equity domain can help to meet the requirements for conducting a health equity assessment. For schools and programs of public health, the Council on Education for Public Health use the core competencies in developing foundational competencies for its accreditation criteria. The core competencies are also integrated into the trained learning network so that learners can locate courses that will build desired knowledge and skills, which we will talk a lot more about towards the end of this presentation. And of course, the core competencies have long been designed to reflect the knowledge and skills needed to deliver the 10 essential public health services. So one of the things that we have been thinking about is how the multiple frameworks we use in public health can all work in concert with one another, and specifically how the core competencies relate to both the essential public health services and the foundational public health services. We recently released a new tool that helps to illustrate this relationship, which I believe Marie will be dropping in the chat for us. And so really what we've been thinking a lot about is how the core competencies reflect the knowledge and skills needed by individuals to engage in public health, whether they are employees, students, or volunteers in a governmental or non-governmental organization, and whether they are providing essential public health services or foundational public health services. Each of our organizations are made up of people, and those people are the ones who plan and carry out the work described in the essential public health services and the foundational public health services frameworks. So developing the core competencies of the people within an organization underlies the ability of that organization to deliver both the essential public health services and the foundational public health services. And of course, in addition to the core competencies, many public health professionals working in specific disciplines and programs also need specialized knowledge and skills in particular areas. So the Council on Linkages works really hard to ensure that there is alignment with the core competencies and other discipline-specific competencies, such as the ones listed on your screen. Before coming to work at the Public Health Foundation, I was on a team that helped to develop the racial justice competencies as part of the Public Health Training Center network. And it was really great to be able to align with a nationally recognized set of competencies throughout our development process. So we are always happy and willing to collaborate to make sure that those relationships are maintained. So after that background about the core competencies, we know that it's not enough to develop a competency set, and there are a lot of pieces that go into implementing this within your agencies. So we are currently focusing on a variety of resources and tools that help individuals and organizations implement the core competencies into their work. So this is just a snapshot of the core competencies tool page on the Public Health Foundation website. You'll see that we've broken these resources into those that help with understanding the core competencies, and then there's a separate bucket of workforce development tools. So all of these tools are completely free for you to use, and in the rest of this presentation, we will highlight just a few. We also have this whole section of the website that has examples of how the core competencies can and have been used in practice. So this page includes competency assessments, job descriptions, training, and workforce development planning. We currently have 2 examples of competency-based workforce development plans that use the 2021 version of the core competencies, one from a state health department and one from a local health department. So both the Missouri Department of Health and Senior Services and the Sedgwick County Health Department in Kansas have given us permission to share their workforce development plans. So you can find those on the PHF website and check them out and see if there's anything in there that might be useful for your workforce development planning. So the first tool that we wanted to highlight is the competency-based job descriptions. So jobs that include core competencies within their job descriptions help to make it easier for applicants to consider what competencies they already are strong in and what competencies they can hope to gain in that particular role. These job descriptions help to link the work functions to the competencies needed to successfully perform that job. So integrating the core competencies into job descriptions can help ensure that the retention and recruitment of public health professionals whose skills are well matched to the needs of those positions. So the next two slides are just some examples taken from job descriptions that were shared with us. I know there's a lot to look at on the screen, but so I just wanted to point out for this project assistant position, it's more kind of an entry-level position. So you'll see that all the competencies listed here are all in tier 1. I also found it very interesting that there were no leadership or systems thinking competencies for this job. But again, just an example of how you can attach competencies to a particular job description. And then in this job description for a local health department public health program coordinator, this one uses all tier 2 competencies. And you'll notice that many of the competencies chosen were about working with community, about having relationships, and communication. So again, just a couple of examples to start thinking about how, some of those things can be added to your job descriptions. And so now I will turn it over to Jennifer to talk a little bit about competency assessments.
Thanks, Mayella. All right, so another tool that we wanted to highlight are competency assessments. And we've really found that this is one of the competency tools that are the most utilized. And when I was with the New Mexico Department of Health prior to coming to Public Health Foundation, I also found the competency assessments to be extremely helpful in our workforce development planning process. So the assessment tools can help in identifying strengths and gaps in skills and knowledge related to core competencies and in determining where you might desire additional training. There are 4 self-assessment tools available, one that contains only the competency statements, and then there's also one for each of the 3 tiers that includes sub-competencies. And completing an assessment will give you a score for each of the 8 domains. So it's really a good way to just determine where you are at or where your workforce is at with the competencies. So let's move on to the next slide. And this just gives you an idea of what these assessments look like. So each assessment is divided into the 8 domains. And for each competency statement within the domain, you can score yourself on how competent you feel in that particular area. The scores for all competencies within a domain are then combined to give you an average score for that domain. Overall, the assessment will show your average score for each domain, which you can then compare to look for areas of strength and areas for future development. In addition to completing the assessment yourself, it may also be helpful to have others, such as your supervisor, complete it to get a more rounded idea of your abilities. And this information can help in developing a training of professional development. You can really also utilize these. They are self-assessments. I think the information gleaned from them can be extremely helpful. And so you can take those self-assessments and distribute them to the members of your workforce to get an overall idea of where your workforce is with those different competencies. All right, so let's go to the next slide. So competency prioritization tools. Also definitely wanted to mention this tool, which is available to support organizations in determining where to focus competency development efforts. The tool uses a workshop-based voting process to help identify the most important competencies for different types of jobs within a public health organization. And it's really a great way to engage your staff in the process of narrowing down where to focus and providing professional development opportunities. Next slide. And this gives you an idea of what that prioritization tool looks like. So this prioritization tool provides guidance on how to determine job category groups and also how to engage staff from those job category groups in the competency prioritization process. I really think involving staff in prioritizing the competencies is a fantastic way to ensure that the development opportunities that you provide later down the line will be relevant to your workforce. I think I'm handing it back to you, Nyla. So next slide. And I also see there's a comment asking about utilization of that tool, which actually we're gonna provide some information on that now.
Great. Thank you so much, Jennifer. So now we just wanted to provide an example from the Sedgwick County Health Department to illustrate how the prioritization tool and the assessment tool can be used. So this information is pulled from a report provided by our wonderful performance improvement expert, Sonia Armbruster. So first, the Sedgwick County Department of Health held facilitated job category workshops where staff participated in discussions about how the core competencies relate to their roles in public health. So participants were asked to consider the competencies within each of the 8 core competency domains through discussion in small groups. Then all staff prioritize the complete list of competencies in each domain. In these sessions, the participants were asked to prioritize the most essential competencies relevant to their roles within each domain. So this slide just illustrates the results of the prioritized competencies that were chosen across the job categories. You will see that there are cross-cutting competencies that were prioritized for each job category, and those are highlighted in green. And so a core competency assessment survey was then created and administered to staff in each job category using only the priority competency statements relevant to them as determined in the prioritization workshops. So we just want to share some of the results from that survey portion of the competency assessment. We won't get into too much detail, but really just wanted to provide some examples of what this process can look like. So this slide just provides an example of responses from client support staff about the competencies they feel they need more training in. And you'll see the staff responses, yes, no, and not sure. And so for this particular job category, you'll see that the top 3 areas where staff felt they needed more training are establishes relationships to improve community health and resilience, engages in professional development, and advocates for public health. So by engaging in both the prioritization and assessment process as part of the workforce development plan, it really helps to highlight the significance of tailoring training to meet specific requirements and trends associated with different job roles. Also, that analyzing competency gaps and aligning them with job categories provides a strategic approach to offering relevant and targeted training. It's really crucial that our training addresses skill deficiencies directly. When we focus on these gaps, we enhance the overall competency levels, which in turn improves the effectiveness of our public health initiatives. And lastly, prioritizing the core competencies is key because it helps staff to better understand how these competencies relate to their roles, which helps to foster a sense of relevance and purpose with their professional development. So just some kind of key takeaways that we wanted to highlight in creating a workforce development plan grounded in competency assessment results offers several compelling rationales that contribute to the effectiveness and efficiency of the organization. So for one, targeted skill enhancement, the competency assessments really help to identify the specific skill gaps and areas of improvement among your workforce. So a tailored development plan based on the results allows for focused training, ensuring that employees acquire the skills that they need to excel in their particular roles. So the targeted approach really eliminates unnecessary training and can maximize the impact of training efforts. Then there's efficient resource allocation. So by pinpointing the exact competency gaps within your organization, resources can be allocated more efficiently. So budgets, time, and effort can be directed towards addressing the identified skill deficiencies, reducing kind of generic or irrelevant training that you might not feel you need for your position. It helps to improve performance and productivity. So competency-based training directly enhances employees' ability to perform their job tasks competently. As individuals acquire the necessary skills and knowledge, their productivity and performance levels increase. So that contributes to overall organizational success. We have enhanced employee engagement and satisfaction. A workforce development plan that caters to individual competency needs demonstrates the organization's investment in its employees' growth. So this can help to foster a sense of engagement, motivation, and job satisfaction among the workforce as employees perceive that their professional development is valued. And then we also have better succession planning and career progression. Competency assessments provide insights into the potential future leaders within the organization. So by addressing competency gaps and providing targeted training, organizations can prepare employees for higher level positions, leading to better succession planning and a more skills leadership pipeline or pathway. So I will now turn into Jennifer to talk about what comes next now that we've done all of these assessments.
Thanks, Mayella. So once you have all your assessments completed, then you can really take those results and target development for your staff. And I did want to also mention PH Wins and how it connects to the core competencies and workforce training. So I'm sure that many of you are familiar with PH Wins, but if you aren't, it's the Public Health Workforce Interests and Needs Survey. The 2024 survey is currently being conducted, and the results from prior years can be found on the PH Wins webpage, which I think that we just dropped a link into the chat for that as well. So PH Wins is really another tool that can be leveraged along with the core competencies to support the training of your workforce. The image that you see here on the left is from the 2021 results dashboard, and this reflects the national survey results regarding the training regarding the strategic skill domains that respondents were asked about. So next to that, on the right-hand side, we have an image of the competency domains that align with the strategic skill domains that were asked about in the PH Wins survey. The domains that you see highlighted with bold text are going to reflect the domains that correspond to the training needs with the highest response rates. So you can see on the graph there, those ones that folks responded to at the highest rates where they felt that they needed training in those areas. And then I also just wanted to mention that while this image reflects the national results, state and local PH Wins results may be available to you. And then the results in the dashboard can also be filtered in a variety of ways, such as supervisory status or public health training background. So if there is a dashboard available to you of the state and or local results, you can really dig into what the responses were based on a bunch of different sort of demographic areas of your workforce. And that can be utilized then to look at where those responses aligned with the core competencies, which you can then use to find development and training opportunities for your workforce that target those specific areas that they indicated that they needed training in. All right, so next slide. And then another tool that's available to you that we're going to give a lot of detail on now is the Train Learning Network. So this is an excellent tool to support the workforce, the training of your workforce. The Train Learning Network is the trusted leader in providing training and other opportunities to health workers. Train brings together a community of partners that are dedicated to build a strong health workforce. This includes our Train affiliate partners and trusted course providers who provide training and other learning opportunities to more than 5 million learners. Let's go to the next slide. All right. Oh, and one more. So we're going to show you what you can do as a Train user. So Train really is a wonderful tool for both individual development as well as overall development of your workforce. The Train National Course Catalog contains more than 5,000 courses, and many of those courses align with the core competencies. As a Train user, you can search for both single courses and for collections of courses. You can save, share, and export your search results. You are able to share links to both individual courses and to collections of courses. And you can, of course, register for and complete courses and also manage your learning transcript. I'm actually going to bring up Train in a couple of minutes to show you these search strategies live in the Train course catalog, but just sort of a general overview of what some of these search strategies are. You can search by keyword. You can also filter the catalog in a number of ways. So you can filter with topic, you can filter by the core competencies, you can filter by courses that meet the CDC quality training standards. You can look for courses offered by specific organizations, and then you can also find collections of courses that have been put into a training plan or another course collection type, which is called a blended learning series. So I'll show you how to find those as well. And you can also sort the course catalog in a number of different ways. So you can sort by newest, the number of ratings that a course has received, and also by average rating. Next slide. And this is really just a screenshot showing you where you can find the core competencies filter in the course catalog. So again, I will show you this in Train in just a moment, but we do have a number of competency sets available in the catalog that you can filter by. And you can really dig down into the different tiers within the core competencies to find really the specific things that you need in terms of training when you're aligning that to the core competencies. Next slide. And then the last area that I wanted to give you just a little overview of that I will also show you in Train is the Your Learning area. So Your Learning contains your current courses. There you can save courses to come back to them later. You can also enroll in training plans and easily come back and find them later in Your Learning. You can view any certificates that you have earned, and you can also view your transcript. So you'll always have access to that transcript in Train. And the transcript also allows you to upload external records, which a lot of folks find very useful to just be able to keep all of your training records there available in one place. All right, I'm going to share my screen now and take you all to Train. Are you all seeing train? Okay, excellent. So one thing that I want to mention, I have not logged in yet, so this is the welcome page. You can get to the course catalog without logging in. So you can access the catalog here and search for courses here. You won't be able to launch the courses unless you're logged into Train, but if you want to just quickly search for things, that is possible. So you can do that without logging in. I am going to go ahead and log in to Train, and then we'll go through some of the things that I mentioned in the general overview that I had slides on. So from the Train homepage here, you can access the course catalog in a couple of different ways. One, you can access it with the link up top that says course catalog. You can also access it here in this sort of middle box where it says courses. If you specifically want to look for training plans, you can utilize this link to get to the area where you can search for training plans. So I'm going to go to courses. And I know I mentioned searching by keyword. So in the course catalog, when you search by keyword, the catalog or Train is going to look for that keyword or words in both the course title and the description. So for example, I'm going to search for health equity trainings. And you'll see I've got a number of results here with that term health in the top. And I will also mention that Train, when you first come to the course catalog, default sort is by relevance. So it's bringing up the most relevant courses based on those keywords that I put in. One trick for searching the Train catalog is it's going to look for each of those words separately. So it's going to bring up courses that maybe just have equity in the title or in the description. If you want to search for a term and want to do that where you have both of those words together, if you put quotation marks around it, then it's going to look for those two words together only. So you'll see I have much less results here now because it's really narrowed down this search to be for the term health equity together. I mentioned sorting, so it does default to sort by relevance. You can change this. So some of the sorting options that I mentioned previously, you can sort by newest. So if you want to find new courses that have been posted to the catalog, and then you can also sort by number of ratings or average ratings, but there's a number of other sorting options here as well. I'll just switch that to number of ratings. So you'll see that sort of changed the view of the catalog there. And then coming to the left-hand side, I wanted to cover a little bit on the filters. So I also mentioned that you can filter by topic. That is actually called subject in Train. It's a subject filter. So if you expand this, there are really a broad number of subjects that you can search by. So you could also, I could remove the term health equity and just search by the subject health equity and find any courses that have been designated with that as the topic. And then the core competencies. So this, I think, is a really fantastic way to find specific trainings that are going to align with those core competencies. So once you've utilized the other tools, you've done the prioritization, you've gone through the process of determining what training the folks in your agency may need based on those core competencies. If you come to Train, you can utilize this competencies and capabilities filter. When I hit select filter here, you'll see, as I mentioned, different competency sets available within Train. The top one here is the 2021 Core Competencies for Public Health Professionals. You can expand this and filter all the way down within the tiers, within the domains. So lots of different ways to find trainings that correspond to the core competencies. You can select the entire competency set. So if you want to see everything that's within Train that aligns with the full competency set, you can do that. Or you can expand those little drop downs to, the specific area that you're looking for. So I'm going to remove that for now. I also wanted to mention this filter for the CDC quality training standards. So if you check that, you'll see all of my results are have this little sort of green ribbon on them. This means that they meet the CDC quality training standards. And if you click on that, you can learn more about that, but it's really a set of standards that guide training developers in ensuring that the training has met a number of different criteria to be considered a quality training. And then collections of courses. So I'm actually going to remove really all of my filters. And I wanted to mention a couple of different ways that you can find collections of courses. So one of those collection types is called a blended learning series. So if you drop down this format filter here and select blended learning series, these are collections of courses that our course providers or affiliate partners have created. And so you've already got sort of a curated set of courses on a particular topic. So we've got, I'll just click on the You Call the Shots immunization training series, and you'll see here, these are the different trainings that are available within that training series. The other collection or type of collection available is training plans, and there's a couple of ways to get to this. So when you're in the course catalog, you can click this little arrow to go back and then select training plans. Or when you're on your home page, as I mentioned before, you can select training plans here, and that will get you to these, this list of available training plans. I do have to say there's a wonderful collection of training plans here available that have already been curated. So it's a great place to start out looking for, a series of courses that maybe cover a specific topic. I know a lot of people find the Public Health 101 training plan to be very helpful, especially for folks in your organizations that may not have a public health education background. So lots of excellent things here that are available to you and have been really curated for use by your organizations. I'm going to go back to the course catalog. So when I was talking about everything you can do with Train, I mentioned that, of course, you can find single courses, you can find collections of courses. I also mentioned that you can save, share, and export your search results. So I wanted to show you how to do those things. It's very easy to send really anything from Train to colleagues if you want them to review them. If you find a course that you want your staff to take or a collection of courses, it's really easy to send that as well. So what I'm going to do, I'm going to go back to Train, and I'm going to just use immunization as a search term. And I'm going to just apply at least one filter, so meets the CDC quality training standards. So now I have this immunization search with this filter meets CDC quality training standards. I can save this with this little bookmark here on the left-hand side. I'm going to click Save Search, and I'm going to give it a title. And what I can do also here is ask Train to shoot me an email when new courses are added that meet these search criteria. So when I do that, I can add that. And now Train will notify me if a course provider comes in and adds a training that has this keyword and meets the CDC quality training standards, I'll get notified. So you can really apply any of the filters here and save that search criteria with that little bookmark. And then later, if you decide, I don't want to get these emails anymore, you can come back to that bookmark page and you can manage your saved searches and you can modify or delete that saved search. If you wanted to send this search to your colleagues, you could do so just by copying this URL up at the top of the screen. And this can be done with really anything in Train. Oh, I didn't mean to go back to the home page. So I'll go back to my saved search, which again, very easy to go back to it as well. If you hit that little bookmark and click on it, you can get back there. But coming back to that, so I could send this query to other people in my organization if I want them to see what courses are available. I could send a single course. So if I were to click on this Fostering a Culture of Immunization course, I want to send just this course, I could grab that URL and send it. And you can also do this with training plans. So I'm going to navigate back to where the training plans are. And now it's bringing up immunization ones because I still have that search term in there. But if I click on this Building Awareness of Immunizations and Vaccines training plan, I could grab this also and send it to people. So this is a really great way to disseminate training. If you have specific trainings that you would like your staff to take, or if you find trainings that you think would be really great as part of your workforce development training plan, but you want other folks to review them, you can easily just grab those URLs and send them to other folks in your organization to review. The last thing I wanted to cover in my little tour of Train for you all is the Your Learning section. So each learner will have this. You can access it here at the top of the screen in the menu items here. And these are the 4 areas that I mentioned in my overview. Your current courses is going to contain anything that's in progress or anything that you have saved. So if you save a training from the training description page, it's going to show up as not started. This is another great way to just sort of catalog trainings for later if you don't have time to review them right then. Your training plans, this is going to contain any training plans that you are enrolled in. And if you had completed them, you would have a completion status there. Under your certificates, you can access any certificates that you have earned, and you can download them here. And then again, under your transcript, this is going to contain your full training history. You can download this transcript, which I think is really nice, especially if you're working with staff and you've asked them to take some trainings. You can ask them to just download their transcript and send you that as proof that they've completed it. Or if they earned a certificate, you could also have them send you a copy of that certificate as well. And then this is also where you can add those external records. So again, you have the ability to save all of your training records in one place, which is really nice when you're getting ready to send all your CEs in for your licensure renewals, to not have to go, searching through your files to find all of those CE records. So it's a nice way to be able to keep everything all in one spot. And I am going to stop sharing. And I think we can pop back to the slides, Mayella. All right, so now, lots of things. So we're gonna take you through a little scavenger hunt in Train. So I do want to mention you can do this on your phone, or you can pull up Train on your computer once we give you the instructions. I will show you, I have some slides that will show you how to do this on your phone because the filters look a little bit different. So if you are doing it on your phone, we will show you how to do that. Let's go to the next slide. So we are going to ask you to use your searching skills in Train to find a specific course. And what we'll do, we'll give you a couple minutes to do this, and then we'll launch a poll so you can tell us what course you found. I'll go through the slides where we show you how to do this on your phone as well. But these are the criteria you're going to use, and then we'll bring this back up. So you're going to find a course that is a web-based training self-study. That's the format. Meets the CDC quality training standards. Under the competencies, the 2021 core competencies for public health professionals, we want this to be a course that aligns with Tier 2 health equity skills. And we want a course that offers the credit type NBPHE certified public health. And I have to apologize. I don't know that I showed you all how to find that. So let me very quickly share Train one more time. And I'm just going to show you where that filter is. So back to the course catalog. If you scroll down the page here, credit type is one of the specific filters. And when you drop that down, you can just type in here NBPH. Yeah, so if you start typing in, it'll find credit types that align with what you're typing in. So that's how you'll utilize that credit type filter. Okay, so I'll stop sharing and we can go back to the slides. And let's pop to the next slide, Mayella. So if you do want to do this exercise on your phone, this will take you to that course catalog. So I'll give you just a minute to grab that QR code if you're utilizing your phone to complete this. Okay, move on. And then if you're utilizing this on your phone, so when you get to Train, you'll see that there is this little sort of sandwich menu or 3-line menu on the left-hand side. If you pop that out, you can click Course Catalog to get to the course catalog. Let's go to the next slide. And then when you're in the course catalog, you're going to want to use this filter and sort button to apply the filters. So when you do that, you'll click on that filter button, and then you can select the specific filter and the specific option within that filter. And let's go next slide. So I told you we'd bring back up the criteria. Oh, when I see Mayella, I think we have a request for the QR code again. So there we go. All right. I think let's now move back to the instructions just so you all have it in front of you as you're searching the course catalog. And then I think we'll give you maybe another minute or so to find the course, and then we'll go ahead and launch the poll.
Maybe Ron, as folks are doing that, I know the chat box has been very active. Is there anything that you would like us to address at this point, just as folks finish the activity?
I am typing a response in as you speak.
Okay, so then no worries.
I'm working on that, but you know, if the people who noted that they're using Train for their BS or baccalaureate or master's programs, which would care to share with us how, we would love to know what they're, you know, how they're using Train for those programs. But I don't want to interfere with the exercise. So if they're going through that,
Great.
but afterwards maybe they can respond to that, offer a little bit more information. Just curious. But I'm going to go back to typing my response.
And thank in the chat the link to the catalog. I see Mayella also shared the link to directly to Train. So I'm sorry about the QR code. I'm not sure exactly why it did not work. So we'll go ahead and I see people are already hopping in the chat. We were going to launch a poll to see what you found. So I think we can do that now. If you didn't find the training that was mentioned in the chat, that's okay. Let us know what you did find. All right. Thank you all so much for your responses. It looks like many folks did find health literacy for public health professionals. A few others found some other ones. So when we put this exercise together, those other courses came up if potentially you hadn't applied all of the filters that we had in the exercise. So it is more than likely just that that one of the filters wasn't selected. So health literacy for public health professionals was the one that we were guiding you to. And I'll go ahead and close the poll. And we can move to the next slide, Mayella. So really just a little recap on this slide that in Train, anyone can locate and disseminate single courses, can export search results, can send, so I have BLS, that's the Blended Learning Series collection, course collection type. So you can grab those and send those to people as well as training plans. You can send those to groups of learners or to individual learners. Lots of things that you are capable of doing in Train. And I just wanted you to think about just a little example from, what I showed you all with the train catalog is think about being a team lead and you're responsible for training new hires to understand introductory public health principles. You could easily log into Train and search for a blended learning series or a training plan that contains that type of material that's relevant to your trainees. And you may find that introduction to public health practice that was developed by the Public Health AmeriCorps and the CDC, and you could send that to your new hires that are needing some sort of basic level introduction to public health practice training. So in that example, you could easily grab that link, which I actually have here, and I will just pop it into the chat. So there you go. And that's what that would look like if you sent it to your team. It would send them directly to the details of that training plan. I know that we had some mention in the chat about sort of the differences between what just the general learner can do and what administrators or like administrators within our affiliate partners would be able to do. And there are definitely some differences there. So I did want to just mention, oh yeah, I see Ron. Ron hopped into the chat and made a comment on that. So that is really what that note about not being able to access data, just meaning that you can't pull like overall reports of everyone in your agency that took particular courses unless you are, a train affiliate and you have that administrative capabilities, but you can still leverage the tools in Train if you're not an administrator, if you're not in an affiliate agency, by just, asking your staff and your folks to just send you proof of completion via their transcript or certificates of completion. So there's a lot of ways that you can still leverage the tools without having the administrative access within Train.
And Jennifer, you may also want to talk about the course providers setting expiration dates and also how we, do look at learner ratings and things of that nature to try to ensure that, or to keep Train current. I'll turn it back to you on that.
Thanks, Ron. Yes. Yeah. So one of the, I think, really beneficial things about Train is that there are a large number of organizations, meaning that they have the ability to provide courses within Train to be accessed by the, public health and health workforce. Those include some of our affiliate partners like the CDC, the VHA, but also include lots of other organizations like, the public health training centers and several others. And so there really is a lot of quality content within Train. We do like for the course providers to put expiration dates on their courses. And what that does, it's not necessarily going to mean that that course is never available, but it gives an alert to those course providers to go back in and just review the training, review the content to make sure it's still relevant, review everything within the training to make sure any links and things like that are still working. And so, they can update the training if there's new data or more current and relevant information. So we do really like for the trainings that are available in train to be relevant and current for all of you. And we do provide some resources and tools and trainings for our course providers to be able to do that.
And Jennifer, if I may add, when we created Train, we meant for it to be very learner centric. Hence, that's why it's free for everybody, and we have what nearly 5 million. Is that the right number? Over 5 million users? I can't even remember at this point. And as far as courses go, we really recruited a lot of course providers to bring in their training and make it available. And the reason why we have ratings in there and we also request, expiration dates is so that we can keep train current, but also it is a bit of, like with Amazon, there's a lot listed there. We can't control and police everything. We do have criteria to permit somebody to post. And at times you might find something that you say, I don't think that's particularly great. And if you find that, let us know. And we can also be in touch with the course provider. But really our intent was to make the maximum training available freely for learners around the US and around the world. Sorry, Jennifer, but I had to chime in.
It's okay.
I'm
Thanks.
the old fogey here,
No, I appreciate it. Yeah, so that was really what I had on track to the next slide. And I just wanted to mention some of the additional products and services that are available through the Public Health Foundation. So we have some services to provide public health infrastructure support, and that includes performance improvement services, workforce capacity and gap analysis, which I think is really critical, especially coming out of COVID and, just understanding what is needed in your communities that you serve and what your workforce capacity needs to be in order to do that. We, of course, have the 2021 Core Competencies for Public Health Professionals, the Train Learning Network, and then also our PHF e-news, which provides resources, tools, and information on performance management, quality improvement, and workforce development. And you can access all of these at our website, which is www.phf.org. All right, we can move on.
All right. So, wow. Thank you so much, Jennifer and Myella. This is, still have some minutes left for question and answers. If you have questions that maybe got overlooked in the chat because it was so robust, thank you all for that great chatter out there. You might want to type it in again, especially if you're forgotten in the train discussion and had a core competencies question that you might want to ask of Myella, please feel free to re-chat that. Or we'll turn to Ron, who maybe has been tracking some of these, and see if there are any other questions that stood out for Myella or Jennifer.
Yeah, I think we've been doing maybe a decent job of answering questions along the way. But as you say, Carol, we may be missing a few things. And I'm wondering, Myella, maybe you can speak for just a moment about how one doesn't even need to use the core competencies just alone. Like if there's another competency set, like the racial justice competencies, how you might be able to put those together in a prioritization process.
Sure, yeah. So I love this question because, as I mentioned in the beginning, the racial justice competencies was something that I worked on in my previous job with the Public Health Training Center program. So it's very exciting for me to see how these two competency sets can kind of work together to meet the needs of different organizations. And so we had one example from the Milwaukee Department of Health, where they really felt that they wanted not just to, use the health equity domain within the core competencies, but really wanted to do a little bit more of that work of being an anti-racist institution. So in the prioritization process, essentially what was done is we prioritize the racial justice competencies as kind of like a ninth domain of the core competencies. And so in that prioritization process, folks that were involved from the health department got to go in and kind of go through the same process, right, of in each domain, which are the ones that are most relevant for different job categories. And so it was really like a nice supplement to get like a more well-rounded kind of look and feel of what were the priorities of the institution for workforce development. And so I can try to find that link, Ron, and drop it in the chat so people can see what that was like.
So Mayella, I have put in the link to the webinar from that Missouri and Milwaukee did,
Awesome.
right?
Yeah.
I think I put it in incorrectly first.
Okay.
Then that was correct, and I put it in a second time as well.
Okay. I was gonna find the video.
Yeah.
Does that answer your question, Ron? Is there anything
Yes.
else? Okay, great.
Yes, it does. And Jennifer, somebody in the chat when doing the exercise said there are too many competency filters or too many competencies when you bring it up. So maybe you could go back and a strategy if you really want to hone in on a single core competency or in a single domain, what you might recommend as a strategy.
Yeah, absolutely. So I do have it up still. I was like, I think I do. Let me pull train back up. So let me go to the course catalog, and it is a lot. If you select the full set, it's a lot of information. And so I do recommend sort of narrowing that down. So again, here under the competencies and capabilities, I'm going to use select filter, and I'm going to use this little sort of arrow drop down button next to that competency set. And when I do that, then the next level of the competency set will be available to me. So, I've got frontline and program support responsibilities, program management and supervisory, and then senior management. So I could select maybe one of these full tiers if I wanted to, or even within these, I could drop this down. So if I am, for example, looking for training specifically for my frontline and program support folks, I could drop down this tier 1, and then I could say, I want trainings having to do with communication skills. I could further filter it within communication skills, or I could just select the communication skills, and then scroll down. I'm going to click apply. And here are all of the trainings within Train that have been selected that they align with that particular tier level and that competency. So that's a really nice way, I think. And when I'm doing that, when I'm looking for trainings based on competency assessments or the PHWIN survey data, rather than using like words, I'm typically going to just utilize that competency filter, go to sort of those specific tier levels that I'm looking for, the specific domains, because then I get some nice broad results that I can look through to see if it's really the type of training that I think the workforce needs based on the actual work that they do and the job categories maybe that they're in that have indicated that they need this type of training.
Mm-hmm.
Thanks, Jennifer. I think that was helpful. There are so many ways to drill down into those levels deeper. And as the train courses are so robust. There are so many out there. It is kind of daunting if you've not scrolled through those before to see 600 in your list and to think, oh, now what do I do? So keep filtering is the biggest advice is what I'm hearing.
And Jennifer, I tried to respond to a question, but you know that my technical capabilities and knowledge are quite limited. And so somebody asked if Train can be linked to another LMS. And maybe you could provide so I provided a response that there can be a single sign-on, that there are API capabilities, but more than that, I don't know.
Yeah. Yes. So the API capabilities, I never remember exactly what that it's application programming interface, maybe something like that. Don't quote me on that. That may not be correct. But that is a way for the systems to connect to each other. So we do have a number of affiliates that do utilize those to connect to other learning management systems or just other systems where they have to report out on, course completion data, things like that. So it definitely can be done. We do have essentially an existing catalog of APIs available that our affiliate partners can pull from. And it does sometimes take a little bit of IT knowledge and setup on your end, on the partner end, to be able to pull in the data that you're wanting based on the APIs that we have available, but it is definitely possible to do that. And so what that typically allows is for you to out of Train into that other system in terms of like reporting and things like that. Workday LMS, I'm not sure if we have any of our affiliates that have an API in place with Workday LMS. So I'd probably have to do a little bit of research to find out if that's one that there is like a connection with.
And somebody asked if it's bidirectional. I believe it is not.
Correct. Yes.
Yeah. Yeah. We're always happy to talk about it. And there is a very good and complex question that we may have to explore offline. And Carol, this may be something that you can also address based on the session that you did yesterday with Les and Matt. But it's I'm going to read it so that it makes sense to you all. Transformation can occur at the organizational, department, and individual level. How can core competencies be applied differently at the organizational, individual, and program levels to guide decisions on where to prioritize capacity building versus proficiency enhancement in order to achieve overall success? There are 3 tiers based on job or tier level. How would you recommend adapting it for organizational level or department focus? Have you separated tiers for whether a department engages in that particular competency, or if you want to administer it to the department versus individuals? I figured I'd read it slowly so we could say we don't have time to answer. But it's a really good question, and there are so many different complexities in that particular question. But let me ask Mayella, and I'm going to ask, Carol or Jennifer, if you have any thoughts to share.
Yeah, I'm thinking about when I was at the Region 2 Public Health Training Center. I don't even know how many years ago now, but we did like a multi-level, like multi-survey assessment with the New York City Department of Health. And so for each division, we went through a prioritization process. So each division head went through the prioritization of the core competencies and chose like, these are the competencies relevant to the folks in my division. I think it was all, we did all tier 2 to kind of simplify it a little bit. And then we had just multiple surveys across every division in the New York City Department of Health. And so it took a lot of time and a lot of effort and a lot of people. But that was just one of the ways that we kind of tried to make it really relevant to each division. And then we provided reports to like each individual division on where their gaps and training opportunities lied. And we also, in addition to doing it with each division, we also did it with a self-assessment and a supervisor level assessment of staff. So the supervisor completed the assessment of their staff as a whole, and then each staff member within the, I don't even remember, like the program or this, subdivision, completed their own self-assessment. So you also got a comparison of what does management think is the, training needs here, like what are the gaps, and what do staff that actually are, boots on the ground think their training needs are. So that's just the example, Ron, that came to mind immediately of something that we have done in the past.
Let me add,
Good,
Ron,
please.
if I could. So if you attended yesterday's session, session number 4 in the afternoon, we talked about some new tools that the Public Health Foundation has been developing. So one of them is a matrix, a master matrix, as such. So it could be used after you've done your core competency ratings as such, and you've done them by maybe different programs or different entities in your health department. You could take each of those ratings, load them into this master tool, this master matrix that rates and then rate them all together. It would then populate for you a rating scale of which ones came to the top or went to the bottom of as you threw them all into the bucket together. Now, as I think you can hear, a lot of this is not magic of a tool, but it's the benefit of having the discussions from your staff at any level, and then crossing those discussions between line staff, mid-management, and supervisor staff to make sure that everybody understands how we all relate together. It's hard work. It takes commitment to do this, but it is so rewarding when you can finally see that the competencies now have a rating to them, and you know what your staff want. You know what your supervisors want out of the ratings, and you know what management thinks, and then you roll it all together to make something happen that's beneficial to all. So long way of saying, yesterday we also had some tools that will be posted out on Train following the conference for you all to check out as well to see if that might help.
Great, and thank you, Kelly, for adding to the dialogue on this. Really appreciate it. And Carmen, I've noticed in different sessions you've asked some really good, deep questions, and we're happy to follow up with you.
Yeah,
Give
definitely,
us a holler.
definitely. Thanks for that. And I got it. Priority matrix first, tailor the survey, give it out to a departmental, organizational level, not just individual level. Because I'm trying to figure that out right now.
Right.
Thanks so much.
Thank you.
Thank you. And with that, let me thank both Jennifer and Mayella and all of you that participated and engaged so wonderfully in our discussion today. Please join us for the next session, Pathways to Justice, Inclusive Practices Shaping the Kansas Heartland. This session will begin at 3 o'clock Eastern Time. And just a quick reminder, you'll need to log back into the Train Learning Network conference page to access the Zoom link for the next session. The link will be available 30 minutes before the session starts. And thank you again for attending this session, and we look forward to seeing you at